So in this situation, I'm gonna go ahead and apply the electrodes. I like to do a crisscross pattern, so if or diagonal pattern, so I'm gonna apply the positive and negative leads across from each other. You could do directly across, you could do side, it really doesn't matter. You could do any of those, really what you want to do. There's a lot of variables here that we can manipulate, but that's what I'm gonna do with Shelby. And so in the unit itself, I'm gonna go over the exact parameters that I would use with Shelby. All right, so I'm gonna go ahead and turn it on. I've got the positive and negative leads here. Shelby should still be comfortable, shouldn't feel anything. For the pulse width, I'm gonna be using anywhere between 60 and 100. For the mode, I'm going to be going continuous mode, and then the pulse rate, or the rate of the tingling, I'm going to be going to higher amounts, so probably 100, 130. I'm going to turn up one side first, and then I'm going to turn the other side. And so I like to just turn it up until you start to feel something. Next step would be, I want a strong tingle that's comfortable, but a good tingle before we get a muscle contraction. So this is all based off of you. So that's the intensity that I'm manipulating. You know, she's kind of middle of the road here. Some people have higher tolerances. I've seen patients that require very little intensity before they feel it, and other patients I have to turn it all the way up and they're like, I still don't feel it. So just change your placements and change the intensity based on how you feel. And so in this situation, I would have Shelby be here. She could be now lying down on her belly or seated, or just whatever's comfortable for her. And I would tell her to apply it for 15 or 20 minutes in that strong tingle. It is very normal for your body to get used to it while it's happening, so it would have to increase the intensity a little bit. But what I don't want is to turn it up high enough that her muscles are actively contracting. That's not the intention here. So set your timer for 15 minutes or so. She's gonna be in this position. We're gonna use this TENS unit. You can move if you want a little bit. It's not going to make it less effective. But if Shelby was a patient of mine, I would use the TENS unit, and then I'd be like, okay, now that you're feeling better, we're gonna be doing it, following it up with exercise, and what I like to use are nerve glides. And so I'll put the link to that in the description, or have it pop up here of a good video to follow this up with, or good exercise. So this is a great way to use a TENS unit for sciatica or lower back pain. You can apply this in the back, the glute, the hamstring, and the same principle applies. So don't really change the settings quite as much, just have the strong tingle and let it be comfortable, but it can be a great way to reduce your discomfort. So if you guys have any specific questions, go ahead and leave them underneath the video in the comments, and I will get back to you. But in this instance, I would just say, hey Shelby, we're gonna do this for 15, 20 minutes. It feels great, good. She's gonna have less discomfort, and then she'll go about her day. If you guys have any questions, let me know. Hope you guys got something from this. And as always, guys, stay healthy, keep moving, and take care of yourself.